So happy Tuesday, everybody. Just to kind of throw a formal introduction, I think one new face, maybe you've seen me before, but Cody with Standard Process. And quick overview about Standard Process is we're located right down the street. Been in business for 90 years. We're a third generation family owned company, and we have over 700 acres of organic farm. So our CEO, our president, Charlie, lives literally right down the street from Waukesha. So to put a face to a company name is pretty awesome. And also having me as a representative just to come out and say hello is actually equally awesome as well. So I get to see people who are using the kits, using the product, and supporting local. So today we'll go over a couple kits, but I only got information for one of them because there's like 60 slides. I'm not gonna go through all 60 slides, but the other one's another 60 slides. You're gonna be like, okay, I gotta get back to work. I enjoy work more than you, which is understandable. So I'll pass out a few things, but we will go over these. So I didn't bring many because I didn't know how many there could be. It was like 50 color sheets, like 4 hours of print. So again, just look at it, take about 5 minutes to browse through it. We'll go over it on the actual PowerPoint as well. But again, I don't like to keep it so stagnant and boring. So any questions, please let me know. So to go over the microbiome kit itself, and then we'll talk about the Omega kit. But the microbiome kit, it was started and actually piloted by Biome Labs. Biome Labs is run by Dr. Gnu. Dr. Gnu has over 450 peer-reviewed research papers, cited over 20,000+ times. He's actually the most cited microbiome doctor, period. So it makes sense that he'd start his own lab. And this is kind of his information. So now to kind of get into the topic of conversation and a little bit about what the microbiome is. So you will hear gut microbiome, skin, I even heard eye microbiome. And the commercial came on and said something to the extent of, have you checked your eyes yet? No, not the ophthalmologist, your microbiome in your eyes. And I'm like, I don't know what that even means. So long story short, it's becoming a very hot topic. And yes, bacteria are major players in the system. So are viruses. So are fungi or fungi, depending on who you hear talk. Now, granted, we don't want to have an imbalance. That's the secret about the microbiome. It's a living homeostatic mechanism. So we'll overview those three, but specifically two of them, because that's what we're testing for in the microbiome kit. And it's more than just bacteria. So they have to live harmonious. That's the word I'm looking to use today. They can't be out of whack. And the only real way to know if they're out of whack is testing. And yes, you can look at your feces, you can look at your poop as well and say, this is like actually, let me get a show of hands. Bristol stool scale, anybody know what that is? So when I say sevens, I mention Bristol stool scale because it's like diarrhea. It's like straight liquids and particles, where the other end of a spectrum, like a 1, is constipation. So we should be somewhere in that middle ground, not far off the spectrum. So whenever I joke with my wife, I'm like, are you at a 7 today? She's like, yeah, it's like a 7. Good, clean family fun. That's what that's what 15 years relationship does for you. So you test, and that is the first way of knowing. Yes, we can look at the physical specimen, but also too, we need to know the bacteria in composition within inside that gut. And the only way to know it, test the fecal matter. So overall, a lot of factors that influence it: weight, sleep, digestion, skin health. I mean, the list goes on. Drugs. So we'll get into that topic here next. But an out of balance gut is basically just an imbalance, right? It could be impacted by who you are, because some of us are just not blessed with the best genetics. You might know somebody who has IBS, maybe Crohn's. Like, there's a plethora of digestive concerns. I can guarantee you go to the doctor right now and mention that you have acid reflux, and it's going to be a digestive concern. So you'll hear me, but I didn't start this saying, but all disease starts in the gut. And I say that until I'm blue in the face. If you've also heard of Jack LaLanne too, the juice guy, he had the juicer. He always says, if it tastes good, spit it out. He's since passed, but I'll keep on throwing these things at you. You are what you eat. I mean, this has been regurgitated to me over and over and over. And ironically, we're all eating Panera, right? But it could be worse. It could be McDonald's.
As far as fast food.
Yeah, as far as fast food, right?
Around here.
Because we're kind of limited, right? I mean, without getting too political, I mean, they're kind of positioning themselves in the proper areas. So we only have a specific choice. So if you're making good choices, let's try to pick from the worst to the best, or the best to the worst. But lifestyle, that's another factor, right? Do you work out? What's your life look like? Where do you live? Do you live in the city? Do you live in the country? What kind of car do you drive? If you drive a super stroke or a power stroke, I'm sorry, you know, or Cummins diesel, well, you're sucking down, right? Not the best fuel. And fuel in general is not really good to breathe in unless you want to party. Biggest thing though is antibiotics. Literally the definition, antibacterial, right? We're killing off everything. Now, maybe you heard me mention in the past, but I'm part of a combat activity that I can't really avoid skin contact. So the minute it gets really crazy in there and one person has like a breakout of like ringworm, everyone's just getting ringworm. I've had a huge amount of bouts of it, staph infections. So jokingly, I'm kind of prone to that based on my activity. Well, when you take antibiotics, yes, you want to wipe out that staph infection, otherwise that will turn into like MRSA or something, then you're just game over. But with bacterias, we're also killing the good stuff off. So interestingly enough, IBS, irritable bowel syndrome, has a correlation with Saccharomyces, a general bacteria or strain that's found in brewer's yeast, or basically is brewer's yeast. But when we're consuming probiotics, we're actually adding more of bacteria into our gut, but we're not necessarily cultivating the permanent residents, the microbiome. So probiotics do a great job at giving you bacteria, but they move right through. They're like hotel visitors. They're not the staff that work there. Antacid drugs, like number one, PPIs are like the most prescribed like gut, like something esophagus drug you can find. Again, like I mentioned, go to the doctor, mention you have a little bit of a heartburn. What are they going to give you? Omeprazole, esomeprazole, and it could be named Prilosec or Nexium. And some of you might be like, yeah, I take that myself. Or maybe you know somebody who has taken them. But if you walk into the grocery store, pharmacy, they're over the counter and they're easy, right? Just take them. Reflux is gone. But that is indicative of a dysbiotic gut. Something's going on. The food's reacting, it's not breaking down, it's just kind of sitting there and fermenting and not really doing what it should do, which is break down and be excreted out.
And those are really only supposed to be used for a max of 6 weeks at a time.
Yep.
And that used to be a lot harder to. It used to be a lot more regulated and a lot more hard to get a prescription. And then doctors would say, no, you need to get off of them. And now you just stay on them forever.
And it's kind of segueing that as well. Cholesterol medication, statins, they're becoming much more readily available and much more readily prescribed. And without going on that topic, the PPI or the proton pump inhibitors or the H2 inhibitors that are more acid reflux purposed, I've been on them for about 5 years before I came off. So kind of a personal story, I was also a patient that was suffering from acid reflux. Well, interestingly enough, went through food testing, blood work, and it's like, yeah, you can't really do gluten that well. And so I'm part of the gluten-free trade. And then I walk into a restaurant and I'm like, I can't have dairy either, because unfortunately I react to casein protein. Well, casein's in everything because it's dairy-based. Almost all milk composition is casein. So I'm screwed. I live in Wisconsin, fish fry Friday's out the window. But I've already had a lot of years of eating that. So I found that out. Well, long story short, I was able to get off medication because I wasn't reacting to the foods that I was allergic to. I don't have celiac, so I got tested for that, but there is still a contraindication. And after working with my nutritionist, my practitioner, et cetera, this really changed the way I lived. So next, lifestyle. We talked a little bit about how you live, even deodorants that you wear. And I know if you work in a factory, you're absorbed by a lot of different fumes, a lot of different senses. I mean, that's where you just got to try your best to do something better than what you're putting into your body from just the chemical exposure. So maybe if I'm making better choices of food, that's one thing. Maybe I'm not using my 5G technology next to my ear or in my pocket as much. Those things all add up. I think of them as like snowball effects. You start adding all these bad habits, smoking, chewing, whatever else somebody might be doing. You're just adding, and eventually something's going to happen. And your gut will pretty much tell you first. So overall, the first thing you're going to see is digestion. That's typical because you're going to have some diarrhea, some constipation. Like I mentioned, you might have a 7 one day and you're going to be like, I can't go to work. But it can also show in cognition, brain fog, lethargy. You might just feel sluggish and you're like, oh, this is normal. I'm just feeling a little weird. Let's take 2 Monsters down. Let's take a couple cups of coffee. That is, again, a Band-Aid. And Band-Aids work really well. And I'm using that term, selectively because yes, you want to control the bleeding, but if bleeding is coming from you keep on hitting your head against the wall, maybe you stop hitting your head against the wall. And again, overall health. So like I mentioned, you are what you eat. I didn't make that phrase, someone did it, but it's kind of smart, right? I mean, if you put a bunch of fuel into your body that is not meant to be fuel and it's just processed chemicals and processed foods, it's not the way nature intended. So symptoms, common sense, 7s, gas, bloating, discomfort. My prior career, I worked with a lot of athletes and they worked with a lot of higher level athletes who were consuming anywhere from like 3,000 to 6,000 calories a day. When I was also competing, kind of a small story, my big days, my weekends were about 6,000 to 10,000 calorie feedings. So huge amounts of food. My body weight was also at a competitive level, so I was much larger than I am now, roughly 100 pounds heavier. And it's just crazy to look back and think, I felt like shit. I'm like, dude, I was walking up the stairs and I couldn't breathe. And I'm like, oh, is it normal? I can still lift thousands of pounds. I'm like, I feel good. It wasn't good. Well, I was bloated all the time. Well, the athletes I worked with had the same problem because they were eating a lot of the foods that were not reacting well to their bodies. Well, common sense, performance is going to be sluggish then. So why would you eat better food? It just blew my mind. And then as I started getting more education, I started learning more, working with special populations. I'm like, this shouldn't be normal. You should be able to eat a lot of food if you want, but slowly build up. That's why they always say if you're looking to gain weight or lose weight, small baby steps, not just massive changes because your gut's not ready for that. You're just hitting with a bolus of 10,000 calories and you're going to be part of those food challenges that you throw up all the time. YouTube, make sure you YouTube it though. Okay. So getting into the actual process and components. So you have your kits in front of you. If you want to get them out just because, feel free. Otherwise, you can follow along with either the brochure or the guide. So going over the microbiome test process, it is sponsored by Biome. Again, that's Dr. Ganoom. Dr. Ganoom is the top researcher, doctor, et cetera, who started this laboratory. Now, the results, just to kind of preface a little bit, are 4 to 7 weeks. The reason why? They were inundated with so many kids and they're trying to hire people. And we just talked about when we walked in, it's really hard to find people to work. So this 1 or 2 people in the dietitian lab are staring at a screen, reading results and making recommendations. So when you send your results in, about 4 to 7 weeks. So it's not the worst thing in the world, but they're looking to get under a month. So just future note, why is my results coming back? And you're bombarding Allison with where's my results? I want to know what I pooped. She's gonna be like, okay, well, that's a 7. That's a 7. So we'll go over some ideal ranges, the overall how to do it. It might be self-explanatory, but I'll give you some kinks, no pun intended, on how this kit works and how to submit it. So biggest thing, right? We're looking to target if you have gut issues, maybe you have inflammation, or you just want to know what the results are. If you're a nerdy tech person, you just want to see what the numbers are. It's pretty cool because you might say to yourself, well, Cody, I don't have any gut issues. Why are you giving me this? Well, prevention, huge preventive component. The difference between this type of information and the information you give when you go to your MD or DO, like at Aurora, is you're already having problems when you see them. But if you can kind of nip that in the bud before, that's what we're looking to do. And by testing your microbiome, you're going to know right away if you're at optimal health. You might see a high score, and there's a bunch of numbers. So we'll go through that. So obviously, this is a home kit, prepaid envelope. You don't pay for anything. All you do is you just do the deed, send it in. Simple, simple. And what it's going to show you is your bacteria, fungi in the gut, and then it'll also give you nutrition recommendation along with supplement lifestyle recommendations. So it's very comprehensive, and somebody physically makes this report for you. They pick out specific things for you directly for your composition. So it's not just a cookie cutter, oh, here you go, here's this, here's this, here's this. I mean, we have a lot of products in our catalog. And if you ever comb through some of the standard process stuff, you know right away. And even what you have access to is a lot. So imagine what they have to choose from and be educated on our information and also get to you. So I'm gonna scroll through here because this is kind of a combination of stuff, but here's how you'll register. So you'll register at the Microbiome SP portal. And that's the website. In your kit will also give you directions. So feel free, you don't have to take photos or write it down. But then there's gonna give you a gut test sample ID, and you're gonna pick your provider. I don't know if it'll be Allison or Dr. Chris, but you'll see either Allison Knight or Dr. Chris Rebholz.
It's probably,
Dr. Chris. Okay, perfect. So, and testimonial, was it simple? Yeah. The goal was just to make this as easy as possible, right? We're not trying to make this clunky or confusing. Well, then what's going to happen is you'll receive updates as the process goes through, and you can also check through the portal itself. It's very, very simple. Then when you send your results in, your practitioner, Dr. Chris, will actually read your results and talk to you about them as they come. So that way, when you see a bunch of crazy numbers, you're like, I'm dying. It's over. He'll help you. Okay. So again, overall, what it tests for: bacteria, fungi, and gives you an overall like nutritional lifestyle balance. And then supplements. So kind of looking at what it looks like, there's a quick snapshot. I don't have to spend too much time on this, but it gives you your kit. You can click your results. So if you see right here, this is where it will show when it's ready, but that's where you register the kit at. And then I passed it around, but just so you can see the actual report itself, in case you didn't see it, there's your overall gut score. So we have never seen yet anyone above a 5 in terms of the gut score. So they were literally half full, right? Their gas tank was halfway full. Most common, 2, 3 out of 10.
Just good, bad.
Yep, 10 is good, less is bad. So we typically saw a very low number across the board. Now, in that subcategory, you're going to see more information. And I think I included a good chunk of it, but they give you a lot of data. But the best thing to know about is, yes, good, bad bacteria. We're just looking to figure that out. That way we can effectively supplement to support it. And you'll see smiley faces. It's actually fairly simple to look at. We're trying to make it very friendly. And of course, if you notice that word, coli, candida, that's the bad stuff. Those are pathogenics. Here's what we're looking at for good balance, right? We're looking for just an overall good green score. And here's the majority of your probiotics. So those are your beneficial species of bacteria. So like I mentioned before, Saccharomyces, which is very closely linked to IBS. So if you have any IBS-like symptoms, chances are you probably have a lower amount of Saccharomyces. Or maybe you have a lower amount of Lactobacillus or bifidum bacteria. Those are really common names. So even if you don't know anything about bacteria, you probably heard about Acidophilus. You probably heard about like Acidophilus, like Lactobacillus, bifidum. They're crazy amounts of words. And I don't pretend to know that I know everything about bacteria, because there's honestly more of those than they exist stars, which is pretty crazy, just like viruses. More viruses exist than stars. So it's really hard to keep track of all these different bacterias, but that's why we kind of cultivated into a good and bad base. And here's that lifestyle report, just going over what you can do, tips, and overall types of foods you can consume. And last but not least, on that far right side, I'm not sure if there's another slide on that as well. No, there's not, but it gives you about 3 different things you can look at if you want to supplement to support. Now, in a perfect world, you would just eat more of the food. But let's be real. I mean, like I kind of mentioned, businesses and restaurants, big business now. At the same time is you can't really like pick out your perfect set meal. You might not even enjoy it either, which is where supplements come into play. Makes it easier, it's more convenient. Questions so far? Yeah.
Is the test, is it like how affected is it by like, so let's say I have 1 week where I'm just like super busy, don't have time to cook, so I just eat out a lot that week, but normally I have a healthier.
Okay.
How much will that affect that?
So quite a bit. And it's basically a instantaneous result. So you're right. When I took my test result, I had a staph infection. What do you think happened? Horrible result. So it is not like a red blood cell test, like our Omega kit. So from the bacteria side, yes, however you decide to use the bathroom that day and what you consume, what your lifestyle looked like, what your stress level looked like will be indicative of the result. So good question. Anything else?
So you want to try to do it around your normal routine if you're outside of your.
Yeah. So that would be a good tip is when you do it, try to travel and do it, right? I mean, try to be in your normal life, not when you like went on a binger of pizza and beer and you're like, we'll see if I test my. Actually, you could as a science experiment. I mean, I kind of did. Like I said, I went through a little bit of a bacteria infection, and sure enough, yeah, it definitely was pretty haywire. So how to make this all happen now? Common sense, we're going to use the bathroom, but there are some tips and tricks. What the kit says to do, unless they changed it, is they want you to take a swab of your like bolus of like your actual stool on the residue of the toilet paper you wipe with. Now, next question is, what if you have no residue, right? Kind of a weird conversation to have at lunchtime when you're eating. But if you have no residue on the toilet paper, what can you swab? The toilet paper? No. So what I did personally was I used a catch. I used like a tin foil or like a tin plate. Obviously, went to the bathroom in a tin plate, picked the plate out of the toilet, and swabbed the stool. That is the only clunky thing about it. Once that is, put it into your tube, you send it in. But do not let the stool drop in the toilet where there's a bunch of other bacteria and water. Otherwise, you're going to probably score a 1 on the score chart. Especially if you live in like a group of people or a home, group of people, like a home, family. If you have a family, if you have a group of people that happen to use the same toilet, you mean your family? Yes. Yeah. So if you have a big family, well, you're going to have a lot of different types of bacteria species, so it's not going to be you. So be cognizant. If you want to use a catch, that is my suggestion. If you're somebody who has a lot of residue on your toilet paper, swab the toilet paper. They give you 2 swabs in case you mess up. If you mess up third time,
Too bad.
Sorry. I don't know how to help you. Questions on that? Okay, so once you send it in, again, 4 to 7 weeks or so, and then you will get your results back with recommendations. With the Omega kit now, I don't have any paperwork on that. Did not come prepared for that one. But that is a red blood cell test. Very accurate, very precise. And you can't front load a lot of fish oil and get a different result. So it's like a hemoglobin A1C. So if you have any diabetics in the room, it's the same concept when you read your A1Cs at the end. It starts to see your balance, your positive, negative versus just an instantaneous result. Like you eat a bunch of sugar, test your blood sugar, and it's like skyrocketed. You don't want that because you don't really know what your level of inflammation looks like. So the Omega test is a skin prick test. So all you'll do is you'll wind it up, pull it down, snap your finger, put it on, I call it a listens paper. I don't really know what else it's called, but it's basically just a sample paper. And you'll send the result in. I'm not sure if Dr. Chris will or if you will, but somebody, basically you can register your kit and see it from there as well. So same kind of process, but it's all laid out inside the box itself. Now, it tests for 4 major things. Overall omega-3 index, which is kind of like your gut score that we showed over here, just an overall precursor of how well your omega-3 balance is. The second thing it tests for is omega-6s to omega-3s. And if you have a massive imbalance of 6s to 3s, that is 100% indicative of a higher level of inflammation. Higher level of inflammation means more chronic issues leading to the future. And traditionally in Wisconsin, we're not eating fish, right? Because we don't live by the ocean. We don't really live by Lake Superior either. I mean, and you're like, oh, I eat a lot of fish. Okay, how much? A couple fillets a week? Well, you need a lot more than that. Unfortunately, also living in Wisconsin. Last, to test for your arachidonic to EPA conversion. Again, just showing you how inflamed you are at a different level. And last but not least, trans fat. So if you like a lot of pork rinds and you're eating a lot of the not so best foods, it will also show that as well. So test for 4 major things. That comes very quickly. It's like 10 to 14 days or 10 to 12 days. I'm sorry, I got mine in 10. I've heard of it under a week as well. So that's very quick. And that's actually a really cool one because that will give you instantaneous results over the course of like your X amount of months or however quickly your body processes this omega-3. So it gives you a really well like oiled marker of how inflamed you are. Questions on that? So if you're squeamish or not interested in seeing blood, maybe Dr. Chris will help you. Yep. But again,
What are like the range for the trans fat? That's interesting.
I don't know the number on the top of my head, but trans fats are interesting because we don't consume a lot of them in like our diets anymore. But back in the day, they were in almost everything. So I think the whole world has been very keen to not putting trans fat in things or like massive hydrogenation. But I don't know the range on the top of my head, but it does give you a scale, which is pretty.
And that's weird that they can just take your blood and they can
I know.
tell how much trans fat is in
I know.
Trans fats index was 0, obviously to 2.5 was red.
Okay.
1 to 2% was yellow.
I haven't seen any massively like, elevated ones. I only saw one slightly elevated. Otherwise, mine was in the green. A lot of people's were in the green. But that just gives you an overall precursor of your diet. I was curious to know, and the doctor didn't really tell me what patient it was, but if I were to stereotype, I'm guessing that person was doing a lot of like fast food pit stops. Maybe they were a truck driver. I'm just going to guesstimate that. I mean, even a farmer too, depending on like, again, what they're using for their like oil ingredients and what they're putting in their meats. I don't know, but it's most of the time they're pretty low. But the omega index has been pretty crazy to see. So one person that we saw from the omega-6 to omega-3 ratio, you should be anywhere from like 4 or 5 omega-6s ish, maybe even a little bit lower, to 1 omega-3. They were like 40 to 1. So they were 40 times more inflamed than they should have been. And that number is actually kind of crazy to think about. And you're like, I eat good food, and I'll pick on everybody. I eat good food. Okay, well, when's the last time you ate salmon? Last night. All right. How about before that? Yeah, okay. I eat tilapia. There's no really omega-3s in tilapia compared to salmon. Why you eat a lot of tuna? Oh, so you're consuming a lot of mercury then. How much tuna do you eat? Can a day? No. Like once a week. Okay, so there's my answer, right? There's the answer right there. We're not consuming any omega-3s. And at the same time, we need to get more in. And omega-3 is definitely linked to cardiovascular health. And most of you probably either A, take a fish oil already or know about fish oil by itself. This test will actually show you if you need it. And hopefully you're not the one that does. Because if you're eating a lot of fish and you're eating a good, well-balanced diet, perfect. Don't supplement.
Casey, how much do you eat fish? I feel like we eat a decent amount of fish.
It hasn't been as much lately, but I just had 2 hours ago.
Did you do your omega test yet?
Yeah, I was just looking at it.
Okay, I wasn't sure if you're reading like the actual like brochure or
So
not,
what do
but yeah, what's your numbers?
My, this 5.62 for the omega-3 index, which is
A little lower.
in the orange.
Yep.
In the orange range. So, another one in a couple months.
Yeah, and the retest is about 3 to 4, maybe 5 months later, after you supplement with X amount of dosing of omega-3s. And for you, what was your omega-6 to 3?
7.1.
Okay. Cool. And yeah, again, 4 or 5 to 1, I think is like the perfect level. Yeah. So he was slightly inflamed, but still not that bad. So he must not consume a lot of omega-6 fatty acids in forms of like soybean oil or canola oil or even general foods too. I mean, because we don't consume a lot of fish, although omega-6s kind of come up. Grains usually have a lot of crazy stuff in them. Like if you eat cereal, they like to hide stuff in there.
How do you fix the ratio? More fish?
Yeah, more fish is the answer as a quick fix, or you would balance out what you're consuming from omega-6 fatty acids. So nuts, seeds, oils, but also again, when you're eating,
lower on.
it depends because let's say you're consuming a salad. We'll pick on a salad. A lot of salads are like good for you. Like, oh, I'm healthy, I eat salads. But if you just go Google search Panera dressing, because we ate Panera, you're going to see cottonseed or canola oil. So if you're somebody who uses marinades or dressings and it's not necessarily made with fish oil, which no one makes them with fish oil, make them with soybean oil because it's cheap. That's a guaranteed omega-6 issue. So, and then even again, if you're not eating the right types of meats, and you're not eating grass-fed organic. And I don't expect everyone to eat grass-fed organic. You're getting a really different composition of fatty acids inside that meat. And that would also elevate the amount of omega-6s you should not be getting. Yeah.
Do you need to eat fish to be considered like optimal? Or can you just use the supplements and be fine?
So in a perfect world, and I always joke I'm in sales, so yes, let's use supplements, right? But I would rather have you eat the food from nature. If you're vegan, they also have algae. We don't have algae. I always joke that I work for a meat company. We use a lot of meat-based components. So we would not have an algae oil. But if you do not eat meat, you could technically supplement with omega-3s. I am a purist of nature, which is why I work for this company as well, because we believe that power comes from the earth. And that's also why we grow all of our own products. So pretty cool. And fun fact about our fish oils too, just so you know, I mentioned them in the past, but we actually make all of our own soft gels. We don't make our own fish, but nobody makes their own soft gels. The reason why we do that is so we can control the process. And then, no pun intended, make it a standard process. Also, what will happen is as they sit on trucks, warehouses, I worked for a big company back in the day, and I went and toured the warehouse. Well, it got shipped to one distribution center, to a next distribution center, to another truck, and then finally to the store. Well, by that time, it's already passed through 50 different hands. There's only one hand that's passing through, it's ours. So that's pretty cool. Any last questions? Otherwise, are we good on time still? I always lose track of.
Yeah, we're still good.
Okay. And that's pretty much all I had for all of you. And I can kind of open it up to anything else you might be having from standard process side, just since I'm here in front of you. Otherwise, if you have any more direct questions on the test. But all of you are taking it since you all have it, which is pretty cool. And that's probably the best thing, is that you're actually doing it, right? Is that it doesn't cost anything. You just wait for your results and it kind of goes from there. But next time I meet with all of you, I'd love to hear kind of some feedback without, I guess that is breaking HIPAA, right? But I guess I don't know your name. Serious. Right, yeah, really. Right. I mean, so, but it is really.
I know, when you're like, Casey, what are your results? I'm
yeah.
like,
She's like, this is a nightmare.
I could have said no, I don't. With the microbiome stuff, I imagine, especially since it's so sensitive to you probably want to trend like a fair bit of time with several tests before you have a good idea what you feel. If I get a wonderful barrel of sauerkraut from Costco, and I have that in the last meal, that's going to be great, but I don't have the next one. It's not gonna be great.
True. And that's why we were saying too, and Alice made a good point, don't break out of your routine when you do it, because a lot of us have a routine, right? I mean, I can pretty much pinpoint anybody. I'm the same way, like my days don't change. And I eat kind of the same things. And whether you eat from one fast food place to another fast food place, it's kind of irrelevant. I mean, now granted, if it's a massive drastic difference, like one day you're having Chipotle and then one day you're just eating air, like a breatharian. Any of you heard of them before? No, breatharians? Quick education on that. It's pretty funny if you want to get on a rabbit hole, like through Reddit or through just Google. It's great. These people have a high mortality rate, I think the highest in the world, and they only think that they believe they can absorb nutrients from the sun, and they can photosynthesize.
Oh.
Well, I'm not sure how many make it, but it is a real thing. So again, if you eat nothing the entire day, then eat something, that's a massive drastic difference, right? You're going from one pillar to the next pillar. So try to be as consistent as possible. That will give you pretty accurate results. But yes, if you are sick and want to do a science experiment, that's kind of what I did. Because again, mine was free as well. So I'm like, you know what? Today's a bad day. I'm kind of going over some bacteria infections. I'm like, let's do it. Let's see what happens. And it was kind of cool. So I kind of took the far end of the spectrum, whereas most of you will be logical and you're probably just going to do it when you have normal food. And I would suggest picking a weekday, because weekdays are usually pretty consistent. Weekends are like, we're getting crazy here. Football's not on, but I'm sure other sports everyone's watching, but football's usually the kicker.
pun intended.
Yes, I'm just throwing puns out. I don't even try to do it. This isn't even rehearsed. I just kind of just do it. But anything else? No? And just to do a quick quiz, how many of you currently use something from standard process? 2, 3, and nothing for you. And out of those 3 people, you 3, like 100 people in the room, what do you currently use? Like the top couple things that you consistently order?
Microbiome Forte and ginseng rhodiola thing.
Okay. And then you, my friend?
Allergies.
Okay. Anything else? Is that just by itself?
That's pretty much it.
And just to pick your brain, I'm not quizzing you. Out of the entire catalog, Allerplex, why that one? Allergies, right? But like, did you just choose it?
No, I believe Chris brought it up.
Okay.
When we were talking. I was getting an adjustment. I mentioned something about allergies, and I think you mentioned allergies.
Okay. Yeah, it's kind of a one-stop shop. It's really awesome. And you, my friend?
Whatever doctor, this giant handful of pills that Dr. Chris recommended, the turmeric, the fish oil,
Okay.
and then I add a couple IU of 2,000 IU of D3
Of course.
every day. So yeah, it's a giant handful of crap.
Okay.
It's like breakfast.
Yeah. And that's kind of what it's like.
Breakfast of the future. It's all
Yeah.
pills.
Well, have you ever heard of Soylent before?
I mean, I've heard of Soylent Green.
Okay. So that's a big name actually. Now I don't know, but the company initially, Soylent, they pitched the idea of not eating food anymore. And it's kind of interesting because, I mean, if you think about it, we're kind of leading in that direction. I mean, we're not really making our own food anymore, right? You go to the grocery store, you microwave it. Well, I even pitched the thought process of, well, why can't you 3D print your food? And you're like, this just sounds ridiculous. Well, we can 3D print a lot of stuff.
Right.
So yeah, maybe in the future, but for right now, yeah, we'll probably still eat our foods. But to take that much in nutrition is not too uncommon because if you think about it, our soil is void of nutrients. So if you're thinking of taking that many pills, you're like, this is ridiculous. Well, you can eat the food. Only problem is you got to eat a lot of it and the right types of foods, which are, again, usually organic and from a really rich topsoil. Well, unfortunately, standard process doesn't grow a bunch of berries and, foods that basically feed the nation, but we're definitely growing nutrients that are, cultivated and prepared at a really high level, which is how farming should be. But I understand there's a lot of factors to it. So that's why supplements are really important, at least from, my side of the fence. And I do take about a handful, usually like once or twice a day. But then again, I take a lot of different things at just a higher amount. Especially,
Should you spread it out?
you could.
Because my wife and I always argue. I just go,
Yeah.
it's going to the same spot, so it'll get there eventually.
Yeah, some
So I don't
people.
know if it's more beneficial.
Allerplex is like 3 pills every 3 times a day.
That's a little bit different though. Yeah, Allerplex is unique, and just to kind of throw some thoughts on that, it has an ingredient called, is it Betaine or Betaine? I'll call it Betaine. Betaine hydrochloride, which is an acid. So typically if you take it with meals, it'll help to digest the foods. Because a lot of times when you consume a lot of the wrong foods, there's an increased histamine response. And a lot of you know about histamine because of Benadryl. And Benadryl controls the histamine response and that like tingly feeling that you might be getting when you're having allergies. There you go. Well, that's a histamine response. So by consuming the wrong types of foods that do not get digested, betaine hydrochloride helps with that process, which is really awesome. So you guys, like in that scenario, take it with meals. If somebody's taking a product called Zypan, which is like our miracle digestive aid for any acid reflux symptoms, yes, around mealtime, right? Common sense. Otherwise, like if we're taking ashwagandha forte, you can argue maybe at nighttime with hemp oil or something. I mean, to help with sleeping and just mellowing out a little bit. Perfect. Or omega-3s, turmeric, pretty much whenever. I mean, I always like to take it with a food source if I can. And fat, I think adding things into fat, especially when they're fat soluble or fat, in composition,